Welcome to the National Immigrant Integration Conference 2020. I'm Congressman Choi Garcia, and it is my honor to join you today, just weeks after the most important election in memory. Like other immigrants, I breathe a sign of relief after Biden won the presidency. There was simply too much at stake for immigrant communities who've suffered at the hands of the Trump administration. His relentless attacks on our communities motivated immigrants to organize, mobilize, and defeat Trump. But now the hard work begins. We need to ensure that the next administration delivers for immigrants, and it is our job to hold them accountable. The next 4 years will not only be about undoing the harmful damage that Trump created, but truly an opportunity to advance pro-immigration legislation like the New Deal for New Americans. We will no longer have to constantly be on the defense, but instead advance access to citizenship, English language learning programs, workforce development programs, and other policies that help immigrants. While the next 4 years may look different, we also know that the fight against COVID-19, which has devastatingly impacted our communities, is far from over. But after months of chaos, I'm finally hopeful and know that the next administration's plan to combat the virus is a plan that won't leave millions of immigrants behind and at greater risk. Thank you to the National Partnership for New Americans for organizing this conference, and a special thanks to the Coalition of Immigrant and Refugee Rights Organizations for your hard work these last 4 years. Let's move forward.
Great. Thank you so much, Congressman Garcia. And thank you all for joining us today. We are in day 2 of our virtual National Immigrant Integration Conference, the largest annual gathering for the entire sector supporting America's immigrants and refugees in this country. This year's NIC is bringing together over 2,500 leaders, representing over 600 organizations across the immigrant rights field. And while we couldn't be in person, we are grateful for everything that you are doing and for joining and engaging with us virtually. And I want to thank all the elected officials and municipal leaders who are joining us this week. You just heard from Congressman Jesus Choi Garcia of Illinois, and you're going to hear from Houston's Mayor Sylvester Turner as well. Our conversation today, right now, is about access to healthcare for immigrant communities in the United States. First, we're going to start with an overview of how federal policy can make a huge difference in opening up healthcare for immigrants. And then we're going to hear from organizations who work on the ground to remove some of those barriers. And we're going to talk about all this in the context of the COVID-19 pandemic and the presidential transition. And this is important, we're going to invite your input on key challenges and opportunities moving forward when it comes to healthcare access for immigrants. I'm telling you, we have an amazing lineup of speakers to come today to go deeper into this issue of healthcare justice. And with no further ado, I want to kick us off. I want to introduce Jacqueline Dean with the National Asian Pacific American Women's Forum, NAPAWF. Jacqueline is the Policy and Government Affairs Director at NAPAWF, and she leads their work on reproductive health and rights, immigrant rights, and economic justice. Jacqueline, I'm kicking this over to you.
Hi, everyone. Thank you for joining today. I will be spending a few minutes going through an overview and just a lay of the land of what healthcare access for immigrants looks like now, both before the pandemic and everything that has happened this year in 2020, just to level set. And so you, when our other panelists are talking about their specific issues, you get a better understanding of what the healthcare landscape looks like right now, what are we working against, and what are some opportunities for the future. Masai, if we could start the slideshow, that would be great. And we'll go ahead and go to the next slide. So I think many of these healthcare issues are familiar to most of you all, given that our immigrant communities are living through this every day. But this is to give you just an overview of what immigrants, depending on their status, are eligible for in terms of federally funded healthcare programs. Right now, immigrants have to navigate a very complicated patchwork of healthcare, and we use this table that is provided to us by the National Health Law Program to really demonstrate what this patchwork looks like. And we have various programs like the ACA and Medicaid, but it depends on your immigration status, and due to some policy and legal barriers, it's very tough to get access to these programs. So you can see in the first 4 columns, if you are a lawful permanent resident with status, you do have access to the ACA. Medicaid, it often depends on your state and whether or not you've been in the country, or whether or not you've had green card status for 5 years. If it's less than 5 years, you're still within that waiting period. Many states have extended that state option for people with green cards under the age of 18, or if you are pregnant, but for about half the states in the US, that's still not an option, and the same is true for CHIP. If you are undocumented, and those who are DACA recipients or undocumented immigrants generally do not have access to any of these programs. So you can see all of the gaps in our healthcare system that currently don't provide adequate access to healthcare, including basic preventative care. We'll go to the next slide. As we all know, the Affordable Care Act really took center stage in the SCOTUS nomination this year, and really focusing on the risk that the Affordable Care Act faces if Amy Coney Barrett was confirmed to the court. And now that she is, it's really up in the air whether or not the Affordable Care Act is here to stay. Oral arguments provided us a little glimpse of hope in that we could see some, pretty solid chances of survival of the Affordable Care Act. But we're really unsure. We're looking at probably a decision in late June. And even if the ACA still stands, as you saw on the last slide, many immigrants still don't have access to these healthcare plans with tax credits or subsidies. And we know that if healthcare is not affordable, it's not accessible. Next slide, please. We will go into a deeper dive, or my colleague will go into a deeper dive about the impact of COVID-19 on certain immigrant communities. But you can see here that the government response to COVID-19 relief has largely excluded immigrants from receiving many of these benefits. So you see here many of the benefits that we would want to go to our immigrant communities, but the CARES Act that was passed and signed into law does not include many of these things, such as direct relief payments. These direct relief payments were only available to families who have Social Security numbers and who aren't filing taxes with ITINs or tax IDs. And so this really harms mixed status families who maybe have somebody with a Social Security number, but not all members of their family have SSNs or are undocumented. This means that not all immigrants are eligible for free testing and treatment or have unemployment benefits, whereas you see on the right-hand side, the HEROES Act that was passed in the House but did not pass the Senate, or was never brought to the floor in the Senate, included all of these provisions, but that remains static, and these payments are still not being made to immigrants. They're still not able to access free testing and treatment. And that is going to be obviously a top priority for the next administration moving forward. Next slide, please. Another important aspect of healthcare that came up this year, but that was maybe not covered as much in the media, is Section 1557, non-discrimination protections. So this is a provision in the Affordable Care Act that provides non-discrimination protections based on your gender identity, whether or not you've had access to abortion, national origin, race, and it also provided a lot of language access protections, which I think is something that was not elevated as much in the mainstream media. So basically what Section 1557 did was it provided these protections, and A rule by the Trump administration was finalized this year, basically eliminating many of those protections. It made the scope of language protections a lot less clear and opened the door for discrimination based on somebody's language abilities, and it harms those with limited English proficiency. It attempted to remove video remote interpreting services, and it also removed taglines that inform the people their right to language access services in the top 15 languages of that state. So typically in bills and a lot of insurance forms, you will get a list. You'll have a lot of these language assistance notices included in there in the top 15 languages. Under this final rule by the Trump administration, those taglines will no longer be available. And so again, as we know, we can make all these improvements to the Affordable Care Act and it can still stand, but as long as these harmful discrimination protections are removed, it still does not remain accessible to a lot of immigrant communities. Lastly, as we all know, public charge has been really devastating on our communities, and this has continued for such a long time, and for over a year and a half, 2 years now. And it's been finalized, but gone through many, many different courts, back and forth, and we've seen this ongoing battle throughout this year. So public charge went into effect everywhere in February, and then it was then stopped due to a national emergency related to COVID-19. And you can see here it's gone through so many different court battles up until recently. The Ninth Circuit enjoined the rule while it's being litigated. So it's very confusing, but all of this to say that, this is the climate that public charge and all these court battles has created is one of fear, one of confusion. Immigrants, are still left in this environment where it's very unclear what benefits they're eligible for and where they can receive care, especially during this pandemic. A lot of misinformation is being spread, and people still are not showing up to their appointments because they are fearful that their immigration status will be jeopardized. And so we bring all of these issues together to give you a landscape so that when we're talking about COVID-19 and underserved communities, we can see, how they've been excluded from these benefits, the systems that they have to navigate through in order to get affordable access to healthcare. When we're talking about a Black immigrant who has to access mental health services, what limited options they have if they don't have Medicaid available to them due to their immigration status, what it looks like for an immigrant woman trying to receive reproductive health care in this immigration environment, and also on top of that, a very harmful environment for reproductive health and rights exacerbated by the pandemic. So hopefully this gives you a clear landscape and level set for a lot of what my colleagues will be discussing from here. And I will pass it back to Steve.
Great. Thank you so much, Jacqueline. And now we actually want to make sure that we are opening up the polls and the chat for everybody to be able to participate here. And so the polls will be popping up on the Socio platform, and there'll also be a chat. And I encourage everybody to participate in both of those. And for the polls, there's two questions in particular that we're going to be asking. Number one, what issues impact access to healthcare for your communities? And number two, overall, how would you describe healthcare access for immigrants and refugees in your community? Is it limited? Is it inconsistent? Is it solid? Is it good? So I think those are the polling questions. I highly encourage everybody to get into it. This is meant to be an interactive session. And some of the questions, and to use that chat, because some of the questions that will be coming up in the chat will make sure that they get to some of the panelists as well. So with that, I want to introduce the next panelist, Kathy Ko-Chin. Kathy is the executive counselor to the board at the Asian Pacific Islander American Health Forum, following 11 years of service as president and CEO of the organization. It's an incredible run. At the Health Forum, Kathy helps to lead efforts to mobilize communities and strengthen organizations to improve the health of Asian Americans, Native Hawaiians, and Pacific Islanders. So with that, I'm going to kick it over to you, Kathy. You're going to be in Kathy's very capable hands.
Thanks so much, Steve. Really appreciate that. And I do have some slides. So Messiah, if you can put those up. So let me just tell you a little bit about the Health Forum. For 34 years, the Asian and Pacific Islander American Health Forum has been the clear, strong voice in the nation's capital, bridging our communities and lifting up their voices from Asian American, Native Hawaiian, and Pacific Islander communities to the highest levels of government, including the administration, Congress, and the Supreme Court. So let me turn to COVID. Next slide, please. And what the response has been from the Asian American, Native Hawaiian, and Pacific Islander community. Let's see if we could go back. Just one slide. Oh, go back. Yeah. Nope. The next one. Oh, okay. That's fine. For communities of color, particularly immigrants who are being disproportionately impacted by COVID-19, we all know this too well. From living in communities where we're more in contact with COVID due to the types of jobs we work in, frontline healthcare, hotel and restaurant workers, food production workers, particularly meat and poultry processing. The lack of affordable and equitable access to health insurance, as Jacqueline conveyed to all of us, because federal policies have locked out immigrants for decades. The glaring absence of data about our communities, including Asian Americans, Native Hawaiians, and Pacific Islanders, in national coverage and policy, and even in the counts of who's getting COVID. And continued deprioritization of language access at a time when confusion is rampant and the science is changing, and at a time when we need the public informed in an accurate and timely fashion. And last but not least, the xenophobia and anti-Asian hate violence that has compounded this for our communities. Next slide, please. Because of this context, both historical inequities and continuing racism and discrimination against Asian Americans, Native Hawaiians, and Pacific Islanders, other immigrants, and other communities of color, we at the Health Forum knew early on that our communities would stand to be left out of pandemic response especially without complete in-language information. We've been here before. For HIV, H1N1, Zika, the CDC turns to the Health Forum to get critical public health messages and information out to communities all across the country. With COVID, it is no different. With our network of community-based organizations, or CBOs, in 35 states and across the Pacific, we have the network and the relationships to disseminate timely, accurate, in-language information to hard-to-reach communities. This is why we at the Health Forum conducted our COVID national work across several efforts. In March and April, the Health Forum pulled together the Community Library and the CBO Needs Assessment. With over 400 resources in 40 languages, the Community Library still stands today as the largest repository of in-language information on COVID in the country. The CBO Needs Assessment is the broadest assessment of 45 different community-based organizations in 45 different communities across the country on the impacts of COVID on our human services infrastructure for low-income and immigrant AAN and HPI communities. We are a member of the National Council of Asian Pacific Americans, or NCAPA, and the co-chair of the NCAPA National COVID Task Force, which is joining forces across a number of areas and conducting joint policy advocacy at the federal level. The Health Forum's enduring policy advocacy agenda has really had tremendous interest and engagement this year by federal policymakers because of COVID, and that includes coverage for all residents of the United States, language access, and disaggregated data. For the very first time in 20 years, restoring Medicaid eligibility for the Pacific Islander communities who are from the Compact of Free Association Nations, or COFA, passed the House in the HEROES Act this year. Then, over 100 partners, including the Health Forum and the Center for the Study of Asian American Health at NYU, submitted letters on the equitable allocation of COVID-19 vaccine, which was initially silent on both Asian American and Native Hawaiian Pacific Islander communities. Fortunately, the disproportionate impact on Native Hawaiians and Pacific Islanders was cited in the final distribution framework, which was sent to the National Institutes of Health and the CDC. but it remains completely silent on Asian Americans, despite having a full section just on health inequities alone. The Health Forum also partners with 8 other civil rights organizations across all communities of color, including the NAACP, Unidos US, and the Congress of American Indians. In our joint work, also known as the Racial Equity Anchor Collaborative, we have worked on how to make sure that all of our communities together are engaged civically. And now we're working with them to provide resources in these times of COVID. Collectively, in April, we distributed $1 million directly to the ground for immediate relief and are positioned to do more if resources were to become available. Our largest and continued effort is the National Asian American Native Hawaiian COVID Health Response Partnership, which is a network of 10 Asian American Native Hawaiian Pacific Islander organizations to develop the AANNHPI response, funded by the CDC, as they also turn to us again for pandemic response. This consists of 2 subcomponent parts. One is training healthcare workers on infection prevention and control, especially those non-clinical workers, including housekeeping, food service, and security. And secondly, a multilingual, multicultural communications, education, and information dissemination campaign that will help develop a communications and response network for COVID, but also for the future. Next slide, please. Let me dive deeper into language access. For immigrants, including the AAs and PIs, there's a heavy toll with the lack of language access. This is one of the critical components guiding our national work. The numbers are telling. There are over 61 million people who speak a language at home other than English. 25 million are limited English proficient, meaning they face challenges navigating English on a day-to-day level, let alone understanding complex issues like COVID-19 testing, treatment, and vaccination. In-language materials for health providers are necessary, especially when accurate and timely information is the difference between life and death. A ProPublica investigation revealed that in New York City, limited English proficient patients are subject to delays and miscalculations due to the lack of understanding between them and their physicians. Assurance for translation and interpretation should be taken care of at the top by the government. An important step forward on this was supporting Senator Hirono and Congressmember Meng on their 2 bills, the Coronavirus Immigrant Protection Act and the Coronavirus Language Access Act. Here we are, 9 months into the global pandemic, and our communities are suffering and hit hard. Native Hawaiians and Pacific Islanders, for example, in LA County, disproportionately are the hardest hit of all communities of color. Asian Americans have been ignored despite emerging data about the disproportionate impact that we too are experiencing. Looking ahead to 2021, we have the opportunity to work with the new administration who is committed to COVID response. I thank you and I look forward to our Q&A.
Great. Thank you so much, Kathy, and thank you so much for all of your work, the amazing work at the Health Forum. Next, I would like to introduce Catherine Labiran. She is the Gender Justice Program Coordinator at the Black Alliance for Just Immigration, BAJI, who also happens to be one of the main partners for this NIC in 2020. She leads BAJI's gender-related research and advocacy initiatives and also engages in national efforts to end the HIV epidemic in Black communities. Catherine, you are up.
Good afternoon, everyone. As Steve kindly mentioned, my name is Catherine Labiron, and I'm the Gender Justice Program Coordinator at the Black Alliance for Just Immigration. While I engage in a variety of work at BAJI, one of my largest areas of focus is research. Because of this, I'm excited to spend my time with you today sharing the preliminary findings of our research on the mental health of Black immigrant women and femmes, a project that will be released during February 2021. Our research was in many ways inspired by the lack of research in that area, the lack of data that examines the unique mental health challenges that people who are both Black and immigrants experience. Additionally, at BAJI, we are curious about learning more about the indigenous modalities that people use to heal, cope, and survive. This curiosity sparked our desire to investigate how interactions with ICE, police, healthcare practitioners, benefits administrators, teachers, family and friends, and so on, impacts the mental health of Black immigrants. Additionally, we were interested in the kind of world that people would create for themselves and their loved ones if finances were not a barrier. Consequently, our research and report is broken into two halves, stories and visions. Before I start sharing stories, I'll begin by sharing some of the demographic information from our research. In total, we interviewed 84 people. Our participants were between the ages of 18 to 84, with the majority of people being in the 18 to 24 age band. With regards to sexuality, our participants identified as heterosexual, fluid, bisexual, asexual, questioning, queer, and pansexual. The majority of our participants identified as women. However, a few of our participants identified as non-binary femmes. 79% of our participants were employed and 21% were not. We had 4 gender justice research fellows that interviewed people in Miami, Minneapolis, New York, and Los Angeles. We asked them 29 questions, and I'll now give you a broad overview of the results. For the questions that we asked to get a sense of our participants' responsibilities, we found that many of our participants were caregivers to their family members, including their younger siblings and grandparents. Many of our respondents refer to themselves as the glue to their families, and that they feel that they have to prove that their family's decision to move to the United States was valid. Consequently, they are not giving room to be human or to be vulnerable. Not only did our respondents share that they look after their families in the US, they also offer emotional, practical, and financial supports to their families overseas. Given the heaviness of their responsibilities, we were happy to hear that 95.2% of our participants stated that they have a support system, and the majority of them named that this support system is very strong. Similarly, most of our participants shared that they know of locations where they can convene with other Black immigrants in their communities. This shows the importance of community in meeting people's needs, especially given the lack of support from the government. In questions that we asked about discrimination in schools and the workplace, we found that several of our participants experienced Islamophobia through being told that they cannot wear hijabs, through being denied their right to pray 5 times a day, and through being denied promotions. In line with workplace discrimination, one of our participants even shared that due to the lack of language accessibility, they did not know that they could take breaks to use the restroom while at work. In educational institutions, our participants voiced that they experienced verbal and physical abuse. One of our participants shared that she was bullied so much about her Haitian accent that she began to stutter and had to get speech therapy. Others shared how poorly funded their schools were, to the point where they did not have a chair to sit on or books to write in. This data paints a grim picture of how resources are allocated in this country. In our section on criminalization, our respondents made it clear that incarceration, detention, and deportation have long-lasting impacts not only on the person who is directly impacted, but also on their families and communities. One participant asked, what kind of childhood are young migrant kids living where they are so afraid of their loved ones being deported? A few of our participants who experienced sexual assault shared that they did not want to tell the police about their experiences because they knew it would lead to their abuser being deported. They were also worried about telling the police about the incidents due to the fact that Child Protective Services would be involved. 65.1% of our participants shared that they had been subjected to sexual assault and harassment. We also know from our research that many Black immigrant women and femmes experience sexual assault in their home countries, during their travels to the United States, and also while they are here. The cumulative toll of this level of violence shouldn't be underestimated, given how many of these women arrive in the country where they do not have access to health insurance, therapy, and have to build a support system from scratch. The majority of our participants identified with having a religious or spiritual practice. Interestingly, most of our participants practiced a different religion or spirituality from the one that they were raised on. Despite the benefits of having a form of faith-based practice, our participants shared that they struggled with faith leaders and family members who told them to pray when they voiced that they had mental health concerns. Some also shared that they practice indigenous African religions like Yoruba religion, and that they have come to see God in themselves through making a shift away from Western religions. Additionally, when we asked participants about their experiences in therapy, we learned that they had the best experiences with therapists who were Black immigrants, compassionate, culturally competent, and who were interested in actively listening and learning about the individual's unique experiences. Similar sentiments were expressed with regards to medical doctors after our participants expressed being ignored, dismissed, and abused in hospitals and doctors' offices. One participant shared that she had to pretend that her family were in the waiting room to ensure that the doctor would answer her questions and give her the quality care that she deserved. And now I will briefly discuss the second half of the report, which is centered on visions. We were happy to find that 95.2% of our participants practice self-care. However, they still see the value and importance in community care. Our participants shared that they want to see more intergenerational conversations on mental health in their communities. They want spaces to be soft and vulnerable. They also want perpetrators of gender-based violence to hold themselves accountable for the harm that they've caused. Lastly, in order to get our participants dreaming, we asked them what kind of world they could create if they were given $1 million to better the mental health of Black immigrant women and femmes. The visions were remarkable, from creating a mental health ice cream truck, to creating an underground railroad for healing, to donating to grassroots organizations already doing the work. Our gender justice report provides us with a blueprint for liberation that I believe, if actualized, could radically change the experiences of Black immigrant women and femmes. We are excited to release this report in February 2021 so that we can begin to strategize and think and dream about how to bring these visions to life and push forth policy change with partner organizations, grassroots organizations, and directly impacted people. Thank you all so much.
Thank you so much, Catherine. That was really incredible, and hearing about some of these communities, I think it's important for all of us to really keep these in mind. I also want to thank everybody for joining in such fashion with the polling and in the chat as well. Seeing some great notes about barriers to healthcare access, including lack of mental health care providers and workers' compensation. How do you use that? And language access, particularly for Black and API immigrants. So thank you so much for that, and keep on with those questions and with the polling as well. Next, I'd like to introduce Ere Rendon. She is the Vice President of Immigration Advocacy and Defense at the Resurrection Project in Chicago. She has served as the organization's lead strategist and manager on local and statewide campaigns that affect the lives of immigrants. And they've played a lead role in the successful passage of many pro-immigrant bills in Illinois, including expanding access to health care and the Healthy Illinois campaign, which I think is a very recent victory. Kudos to you all and all the advocates in Illinois who made that happen. And so we're very lucky to have Ere Rendon speaking with us today. Take it away.
Thanks, Steve. So first of all, I want to let you all know that I get really nervous speaking. And so I usually start with a joke, and that kind of helps ease the pain, but it's not possible when you can't see the folks that are in the audience. So I'm just gonna pretend that I'm not nervous and get going. So buenas tardes, my name is Ere, and I have DACA. And my parents are both undocumented. My mom is actually going to turn 65 years old in March, and for her birthday this coming year, I'm going to enroll her in Medicaid in Illinois. Since 9 days ago, Medicaid has officially opened for undocumented immigrants who are 65 or older in the state of Illinois at 100% of the poverty level. So I do work with the Resurrection Project, but this is actually a Healthy Illinois coalition win. So Healthy Illinois started about 5 years ago, and it's staffed out of the Alivio Medical Center, which is a federally qualified health center in Chicago, or an FQHC. And the coalition was actually started by Carmen Velasquez. She was the founder of Alivio Medical Center. And when she retired, she decided that she was going to spend her retirement trying to get health care for the undocumented in the state, because of the number of people that she would see coming in to the health center that did not have any access to insurance or Medicaid. So she started by meeting with a bunch of folks saying this is an issue that we need to pay particular attention to, and start a coalition that was going to focus specifically on passing legislation that would expand access to health care for all Illinoisans. And she's in it until we're completely done. So the coalition is made up of dozens of partners. Some of they range from hospitals themselves, a lot of safety net hospitals that often see the undocumented community and see the consequences of not having insurance. We also have a couple of hospital associations on the team, and then also in I don't know how everything is across the country, but in our city, it's really our county that takes on the bulk of the healthcare work. So Cook County is also very engaged in the campaign. We also have a Shriver Poverty Center, which is our policy partners, and they do a lot of the writing and the research when it comes to being able to make sure that we're expanding Medicaid in Illinois the best way possible. We also have some of our larger coalitions. So the Illinois Coalition for Immigrant and Refugee Rights is a part of this coalition. And then we have a lot of community-based organizations that are a part of this, that are across the state to make sure that we're reaching some of the legislators that are downstate, as well as in the suburbs of Chicago. The Resurrection Project is an executive board member, and it's a campaign that we have been very active with, especially since Alivio Medical Center is just down the street from us. Healthy Illinois believes that healthcare is a basic human right, and our ultimate goal is that one day not a single immigrant in Illinois is left out of healthcare because of their immigration status. So we think a lot about those legal permanent residents that it earlier was demonstrated by Jacqueline, right? A lot of legal permanent residents under the 5 years. We think a lot about TPS holders. We think a lot about the documented, and we particularly think a lot about the undocumented. And we have some guiding principles. So for instance, our principle is that we will always start off the legislative year going for our North Star, which is healthcare access for everybody. So everything that already exists should be open to everybody, regardless of their immigration status. We also think of this as through making sure that we are not excluding legal permanent residents because we're so laser focused on the undocumented, or also making sure that there is other campaigns that exist to reach equity, such as keeping hospitals open in communities that have been really hard hit by different economic issues. We also get engaged in those types of campaigns. So I want to talk a little bit first about what we had leading up to December 1st. Illinois, about 13 years ago, did pass All Kids, which is our Medicaid for children. And when it did that, it did allow undocumented children to obtain their All Kids insurance, or Medicaid. Or Medicaid lookalike, really. And so undocumented children are able to get Medicaid up until the age of 19. And then at 19, everybody basically is aged out. And then, as Jacqueline mentioned, some of the only stuff that's available from that point on is for mothers that are expecting, or for emergency Medicaid. Everybody who is a legal permanent resident for under 5 years, or who has TPS, or is undocumented or DACA, is left out of all Medicaid after the age of 19. So we have for several years been filing a bill that would basically allow folks to be able, that would establish a Medicaid lookalike program for folks that are over the age of 19 and allow anybody to enroll despite their immigration status. This was a very interesting legislative session, I'm sure not just for Illinois, but across the country. Our 6 months of our legislative session got chopped down to 4 days. And so what we did was a lot of work in making sure that we met with every single Latino caucus member so that they would make this a priority of the Latino caucus. And we were able to include the expansion of 65 at 100% of the poverty level in a large omnibus bill that the state had to pass. And we were able to assure that the funding, so there's two different bills in Illinois. I'm not sure how it works everywhere else, but you have the bill that just says this is what we want to do, and that's called the BIMP. And then we have a bill that says this is how much money we're appropriating. And we had to make sure that both what we want to achieve and the appropriation was in there. The population is actually relatively small. It's actually under 2,000 people, but this is something that people will age into every year, like my mom in March. And what we're very excited for is that what's next to come is that we have several ways to move forward. Should we try to expand the age of all kids from 19 to 26 to make sure that up to 26-year-old undocumented folks are included? Should we try to lower the age from 65 to 60 or increase the income from 100 to 120%? So those are all discussions that we're having. We'll always start with our North Star, and then we're going to fight and get the expansion that we can get. Thank you.
Wow, Ari, thank you so much. That is an amazing victory. Congratulations to you and all the advocates who made that happen. And I can already see right now there's a bunch of questions about that big victory, so we'll get back to that in the Q&A. Last but certainly not least, I have the distinct pleasure of introducing Lara Molina. Lara is the founder and executive director of Sueños Sin Fronteras de Tejas. Her organization focuses on the intersections of immigrant justice and reproductive health and justice in South Texas and provides mutual aid support to immigrant women and their families across the United States. So Laura, take it away.
Thank you so much, Steve. It's a pleasure to be here with you all today and to be just in community with such wonderful panelists. I am just in awe and just honored to be here. So yes, my name is Laura Molina. I identify as a Tejana, third generation Mexicana. I have ancestors that were indigenous to Texas before it was Texas and it was still Mexico. I am the co-founder and executive director of Sueños Sin Fronteras, which in English means Dreams Without Borders. And it was founded in the summer of 2018. Sueños Sin Fronteras is a Latinx and survivor-led collective aiming for better health outcomes and increased healing opportunities for immigrant women and families in South Texas. And we do this through direct service, access, and advocacy. Our work is largely inspired by Loretta Ross and a caucus of amazing Black feminists and their vision for reproductive justice, which was realized at a 1994 pro-choice conference. And so their vision for reproductive justice goes beyond the pro-choice, pro-life debate, and it has three primary principles: the right to not have a child, the right to have a child, and the right to parent in safe and healthy environments. And so Sueños Sin Fronteras, my collective, we work from this reproductive justice framework to identify, challenge, and dismantle structures that dehumanize and oppress immigrant women and families in South Texas. And so on that note, reproductive and other healthcare restrictions aimed at immigrants, particularly in Texas, are extremely harsh and punitive, and they deserve special attention. And so I'm just going to kind of quickly highlight some of these policies. So undocumented folks are ineligible for all medical insurance programs, and documented immigrants in most states in the United States are eligible for Medicaid, but only after a 5-year waiting period. However, the state of Texas refuses to provide coverage to immigrants who came to the U.S. lawfully after 1996, even when they have completed the 5-year waiting period. So what that means is that a pregnant woman in Texas is ineligible to receive contraceptive services and devices, prenatal and postpartum care, testing and treatment for HIV and other sexually transmitted infections, breast and cervical cancer screening, diagnosis, treatment services. So in 2002, the Federal Department of Health and Human Services began to allow states to use federal funds to extend prenatal services to pregnant immigrants, regardless of their status, and that is the CHIP perinatal program. And states can decide to cover all maternal health needs, but Texas declined, and the legislature voted to cover medical care only for the fetus and not the pregnant person. The Affordable Care Act, also known as Obamacare, includes restrictions on health coverage for undocumented individuals. And although the ACA did allocate money for community health centers for low-income populations, Congress cut this allocation by 25%. So that leads us to also the federal Title X program. And Title X is the only federal program dedicated to providing family planning services for low-income patients. It supports nearly 4,000 service sites nationwide, serving approximately 4 million people per year. And Republicans in Congress have been focusing on the complete elimination of Title X. And so specifically, our collective, Sueños Sin Fronteras, we receive Title X funding for reproductive health education, counseling services for undocumented women in South Texas, undocumented women and other folks and youth in South Texas. We receive this funding from the only Title X funder in Texas, and they are an organization called Everybody Texas. And so Sueños is 2 of community-based groups in Everybody Texas's program that provides health education and prevention services. And the rest of the partners are Title X funded clinics. So we're able to provide reproductive health counseling to undocumented individuals, adults and youth, and refer them to free Title X clinical services such as contraception, family planning, and other services related to reproductive health care. And so many of the women and the families that are supported by our collective have been directly impacted by these cruel and xenophobic policies that have been implemented by multiple administrations over the past decades. And some of these punitive policies are the public charge rule, family separation, ICE detention, and deportation, also acknowledging that ICE detention and deportation are forms of family separation. And we're seeing how these inhumane policies have manifested into our clients' lives. Many of the women that we work with are grappling with post-traumatic stress, anxiety, depression, and adverse health outcomes since arriving to the United States. And the reproductive and mental health of individuals is profoundly affected by the current immigration policy. And so last month, I believe it was published in November, a New York Times article came out and talking about undocumented women, in particular in Texas, that are risking their health by postponing prenatal care and giving birth at home in response to the Trump administration's immigration enforcement policies, and like the public charge rule. So, folks are hearing from other members in their communities that applying for any type of public benefits could target them for deportation or jeopardize their application. And so this is really creating a lot of fear amongst the community. So our work ensures, reproductive justice and health for undocumented folks and their families. And that means having access to financial support, freedom from police and ICE harassment, change, just the dismantlement of these punitive and oppressive structures, and giving the families the ability to live joyful lives in a safe and healthy environment. And so our organization, in response to the COVID-19 pandemic, in addition to the reproductive and sexual health services that we provide, we launched 2 mutual aid funds for adults, children, and infants directly affected by the immigration enforcement apparatus, known as ICE and CBP, at the border and in South Texas. And so we had the Active Solidarity Fund, which was launched in April 2020, and provided commissary and phone salvo to 35 families in ICE detention in South Texas, ICE family detention. And the families included 65 adults and 52 children between the ages of 1 to 15 years. And then through our Empowerment Mutual Aid Fund, we were able to provide the undocumented community over $60,000 in mutual aid. So, our programs are rooted in the community, rooted in the voices and needs of the folks that we work with. And, we really do have the power to, it's not just about building sustainability, doesn't just call for closing the loopholes in the current state and federal policies. It requires the community to assert themselves and use their power to enact structural change. And it requires us to use self-determination and solidarity to envision a better future for our communities. Thank you so much.
Great, thank you so much, Laura, and really amazing insights and lessons learned, really from what's happening on the ground in your community. And I think an important lesson for us all in thinking about how we need to overcome some of these barriers. So with that, I want to move to the question and answer session. I want to thank everybody for putting such amazing questions into the chat. So we are going to kick it off. One question, which I think is on everyone's mind, and I want to open this up to anybody on the panel. How do you imagine things are going to be different in a Biden administration when it comes to healthcare justice for immigrants? So with that, I want to see if anybody wants to take that piece on. Go ahead, Kathy.
I'll take a crack at it. Well, certainly we already know that President-elect Biden has 4 priorities of racial justice and racial equity, climate change, the economy, but not least of which is COVID response. And that we do know that there are people that we know, certainly the 2 Asian American leaders in the President-elect's COVID task force, Dr. Vivek Murthy, who's the former Surgeon General and now the prospective Surgeon General, as well as Dr. Julie Morita, who's Executive Vice President at Robert Wood Johnson Foundation, are both on the President-elect's COVID task force. Also, just today it was announced that Dr. Marcela Nunez Smith is going to be the ongoing chair of the COVID response task force, and she really has already led health equity issues. She comes from the Virgin Islands and has been really focused on disparities for those from the Caribbean. So I do feel very confident that the response, well, it can't be any worse than it is now, but that the response under the new administration will really address health equity as well.
Okay, great. Anybody else want to take that on? Catherine or Jacqueline? You guys want to weigh in?
I can quickly, sorry, Jacqueline.
Oh, go ahead, Laura. Go ahead.
Yeah, I just wanted to quickly say too, I think that when we're thinking about, what are some concrete things that the Biden administration can do, I think that we cannot achieve healthcare when we have these punitive immigration policies. And so that calls for, not so overturning some of these policies like the Remain in Mexico policy, but also focusing on, not expanding detention with that. So, increasing, folks, their abilities to enter this country, but not, filling up detention centers and, actually, advocating for the abolishment of these detention centers too, because we cannot have health with these systems still in place.
Mm-hmm. Great. That's a really, really critical point. Thank you for that, Laura. I want to move to another question, which is this question. We're talking about the federal level. Now, if we take it down to the local and state level, question is, what are some concrete things that local and state elected officials can do to improve healthcare justice for immigrants and refugees? And, Ari, I know you had talked about that, but I wanted to see, are there other concrete things that local and state elected officials can do?
I want to add that in the absence of being able to pass legislation that would open up things like Medicaid, having really robust federally qualified health centers and a network that supports them and the state supporting them is crucial. That is where most of the undocumented folks, when they're able to go see a doctor, that is where they go. And although it's pretty robust in the city, once you get outside the city of Chicago, locally, it gets less and less, you have less and less options and less opportunity. So being able to really have those be strong would be very helpful. And then also to include things like dentist and optometrist, some of the things that we don't often think of right away, but that really do become a big hurdle, especially for folks as they age.
Great, thank you. That's a really important point, Ede. Anybody else want to take the question of what are some concrete things that local and state elected officials can do? Laura, did you want to say something about Texas?
Yeah, I can just just briefly add about in the context of Texas. I think just of course increasing awareness and disseminating education around this in ways that is really going to resonate with people and really a lot of people don't know that these are the kind of restrictions that exist, especially fellow Tejanos and Latinos, in Texas. And so I think just really mobilizing around that education and also, encouraging the Texas legislature to close the Texas coverage gap. So ensuring that individuals, all individuals, under the federal poverty line do qualify for healthcare services and that aren't excluded, and that Title X services isn't the only avenue to access, family planning services. We cannot have pregnant women scared to go to the doctor because they are afraid they're going to be targeted by ICE or to be deported. So that can't happen. And I think that just increasing education and, encouraging advocacy around, the basic human right that healthcare, everybody deserves access to healthcare.
Great. That's a really important point. Thank you for pointing that out. I want to note that there are a couple questions about the Baji mental health report. Folks felt that the data and slides were really illuminating. So I want to make sure that if we can make sure that the ability to access the link or the data and the slides can get put into the socio chat for the Baji mental health report, that would be great. And then, Catherine would love to hear your thoughts about the Biden administration and what can be, done from them.
Yeah, so I actually just wanted to mention that the data and the report actually isn't released yet. So that was actually our first time doing our preliminary findings. It will be released in February 2021, but you can definitely keep in contact with us by shooting us an email, info@baji.org. and we'll keep you up to date with when we launch the report and also have our release webinar. With regards to the Biden administration, we know that the process to undo the magnitude of harm that the Trump administration has inflicted on the country will be a long duration. So we want to continue to apply pressure on them and hold them accountable. And, for Black immigrants, we are typically forgotten when we're thinking about moving towards this vision of access to healthcare. We see this when we are discussing things like language access, and there's very rarely translation and interpretation into African languages. So we want to make sure that when we are talking about access to healthcare, that Black immigrants are not forgotten. We also know that this conversation about access to healthcare is only a first step, because we need to also grapple with the reality of medical violence, mistreatment, and the dismissal of Black bodies in medical institutions. Because unless we think about the racism, xenophobia, transphobia, ableism, fat phobia, all of these huge issues that people experience, then Black immigrants will not feel safe in healthcare institutions, and this move towards access will just be very limited, and it will not be inclusive of all people. So we really want to think of strategies outside of just passing very minimal policy shifts to ensure that everyone can actually get the treatment and care that they need.
Great. Thank you. That's super. That's actually really important. There's a question that's been posed. Have previous immigration reform bills addressed immigrant access to federal healthcare programs? And if so, has there been an effort to change these regulations? So maybe Jacqueline, do you want to take that piece on?
Sure. I can say a little bit, and then maybe Kathy can add on as well. Unfortunately, healthcare reform and immigration reform have been traditionally pretty siloed. So during the Obama administration, when they were trying to pass the Affordable Care Act, one of the compromises that was eventually made was that undocumented folks and DACA recipients would not be allowed to enroll in the ACA. And that was a really big upset. And it eventually got basically pushed over to immigration. And they said, well, maybe this is something that we can fix in comprehensive immigration reform. And so it just kind of got, pushed to the side. And at the next attempt at comprehensive immigration reform, 6 or 7 years ago, it then was, left off the table, and eventually it didn't pass. And so, because the healthcare reform spaces have not always been really active in including immigrants, and then likewise immigration reform hasn't always been really inclusive of healthcare, there's been this gap of, efforts specifically focused on immigrant access to healthcare. There is a bill that a few of the groups here, so BAJI and API Health Forum, are both part of a coalition that we lead at NAPOF called the HEAL Coalition. We help advance the HEAL for Immigrant Women and Families Act. And basically what this would do is it would eliminate the 5-year waiting period that the immigrants have to wait before they're eligible for Medicaid, even though they have green card status. It would enable undocumented folks and DACA recipients to enroll in the ACA with tax credits and subsidies. And it would also restore Medicaid eligibility for COFA citizens who have been excluded from Medicaid since 1996. So it's undoing a lot of these really harmful policies that have been in place for decades now to exclude immigrants from federally funded healthcare programs. And it also expands the ACA so that it is available to everyone. It is it's not what we would call progressive, because, we're just bringing immigrants, we're just allowing immigrants to be able to access the same healthcare systems that citizens have. But, in the current Congress, it is considered something that is more progressive, and that is a marker bill. Regardless, that bill is a way for us to really indicate our support for what we would like the world to look like, and what we would what we would have to do in order for healthcare programs to be accessible to anyone, regardless of immigration status. But if you're interested in joining and learning more about the HEAL Act, please feel free to reach out to me.
Great, thank you so much. Kathy, did you want to?
Yeah, let me just follow up on that. So thank you, Jacqueline, especially for NAPOF's leadership on HEAL. the Heal for Women Act. It's been a really important leadership role that you all have played. I think this is where, just as Jacqueline said, because immigration is so siloed away from healthcare, and what we're talking about is really the intersection of these two things, this is where community mobilization is really, really critical. What we really need to do is make sure that when there are bills that on the immigration side that could reflect health justice, and on the health side could reflect immigrant justice, that our communities and our voices are there to push our members of Congress and to really make sure that they understand that you can't have comprehensive immigration reform without some aspect of health, and you can't have better health legislation without making sure that we can include immigrants. Thanks, Steve.
Great, thank you. There's a bunch of questions for Ere, which is great because I think it gives you an opportunity to talk about the amazing success you guys have had. So questions about outreach strategies and messaging. There's a two-part question that I want to ask. Number one, what outreach strategies and messaging have been successful in getting folks to seek the benefit given the fear and the public charge concerns? And then on the other hand, what messaging did you use was effective to persuade moderate state legislators and the governor to back this? So it's a two-part question I wanted to ask you about messaging and outreach strategies to these two different kinds of communities.
So for the messaging for legislators and the governor, we actually also took some messaging points from the California coalition that's similar, but basically leading with values about that we do believe that healthcare, that access to healthcare is important and is a human right. And so in generally, if we kind of frame it in that sense and equity, and we were able to get the Latino caucus, we were able to get support from the Black caucus and kind of like the Democrat more, in Chicago, you'll have like the North Shore liberals. And then to get the suburbs, we did do a lot of research. So Shriver Center for Poverty Law is our policy partner around the cost of what it would cost to do just 65 and over at 100%, just 60 and over, to kind of ease the feeling of, especially for when you think of seniors, you think of that it's going to be a vast cost for the state. The thing is that there's very few undocumented seniors. There's only, from our research, only about 1,500 in Illinois. So the number starts off very small, and it's gonna grow. So that was something that was very helpful, just to say, like, listen, this is the population that's gonna end up seeking medical attention anyways, especially during the time of COVID. So for actually probably less money, you'll be able to start covering them through Medicaid. So that's actually what worked relatively well. And talking about folks regardless of their immigration status versus undocumented folks, especially because we are also want to make sure that legal permanent residents under 5 years, TPS holders, documented folks, right? When we're able to get to that population, that they are included. And so that was really helpful, just to be able to very much clearly state what the cost is. You can't ignore the cost, especially when it comes to healthcare. It's going to be the #1 question. And then in terms of reaching the population, I think, well, it just opened up 9 days ago, and I think we're actually behind on trying to do outreach. This does not affect you for public charge, and if anything, it might be positive given that you're going to have health insurance. So we do a lot of that messaging, and we make sure that it's messaging coming from attorneys. We're doing a lot of trainings with different healthcare providers who are who assist folks, like different navigators at organizations across the state that assist folks in enrolling for Medicaid. So they're rolling out a program to make sure that they're all trained, and letting them also know that they should not, that public charge is not an issue. So that at the moment that somebody attempts to apply and is getting assistance, they are once again reminded that it is not a public charge issue.
Great, thank you so much, Ari. That's super helpful. I want to close by asking all of the panelists in 15 seconds to respond to this question. I want to riff off a question that Catherine had asked earlier, and Baji had asked earlier in their report to participants. And so the question is, how would you use $1 million to support the health of immigrants and refugees? So that is the question, and 15 seconds for folks to just give a super brief answer. I'll kick it off to maybe Laura, you want to start us off?
Sure. So my response is going to be really simple, and I think that's redistributing that $1 million and putting it into the hands of the immigrant communities, so that they can build healing pathways for themselves, and they can, heal their communities as well. So definitely redistribution of those funds into the hands of the people that need them.
Maybe Kathy, do you want to go next?
Sure. Staying on the theme of mobilization and lifting up our community voices, I would use those resources so that we could really make sure that our different communities all across the country are trained and are ready to speak to their members of Congress or their state legislators to really make sure that their voices are heard and that the needs that our communities have really enter into the policy dialogue.
Okay, great. Love that. Love that. Catherine, since you and Baji asked a very similar question, I'll pose that question to you.
Sure. I can answer very simply that I will just use that money to bring to life the visions of the people that we interviewed for our report. So I'm excited for you all to see that, because it's definitely a blueprint for liberation that we should follow.
Thank you. I love that. Looking forward to it. You're making us wait 3 months. We're waiting with bated breath. Ari, would like to go to you next.
Yeah, I would have it go to the Healthy Illinois campaign so that we can keep winning expansion of Medicaid for undocumented folks in Illinois.
Great, great. And last but not least, Jacqueline.
This is such a hard question, but I think mine would have to be a combination of Kathy's and Laura's, which is to invest a lot of that money into our young immigrant organizers, because they have been able to do so much for our communities and really push the needle forward in a lot of the issues that we're talking about. And I really believe that if you invest in one organizer, you're investing in so many people all at once. So I would put it in the hands of young immigrant organizers.
Great, amazing. Those are amazing answers. Thank you all. And so I want to close with just a couple comments. I think one thing that's clear is that healthcare justice is immigrant justice. And it's essential that we continue our work and organize to address the many barriers that immigrants and refugees face to access quality care. As Jacqueline laid out at the top, immigrants and refugees have to navigate a crazy quilt patchwork of healthcare options, if they have any options, due to their immigration status and access to resources in their communities. And our incoming president, our administration, elected officials, Supreme Court, they have to stand for inclusive healthcare policies that include immigrant communities. And we've got to continue to improve on legislation like the Affordable Care Act to really make sure that our communities need the care that they need and deserve. And as we heard from Ere, we can learn from states like Illinois that have expanded access to healthcare for undocumented seniors. What a great victory. And we've also got to name and address the mental health of all our communities, as Catherine from Baji discussed. So thank you to all the amazing panelists. But I want to highlight that there is more that we can do together. And that's one of the reasons why we had this NIC, is to think, what can we do all together? And so I want to highlight two things. At the national level, NPNA currently supports two pieces of federal legislation that would improve access to healthcare for immigrants. Number one, the Health Accountability and Equity Act, HR 6637, and the HEAL Act, HR 4701. Each of these bills offer provisions that will remove some of the barriers that we're discussing today at the federal level. And there's similar efforts that are being carried out in state houses and city halls across the country. And I also want to flag, now that we're speaking about federal legislation, I want to flag the New Deal for New Americans that Congressman Garcia mentioned up top. And that is a broad vehicle for immigrant inclusion policy. And as part of that would be the establishment of a national office for new Americans, which would strengthen federal policy on issue areas like healthcare. So we know that 2021 presents new opportunities for action on healthcare justice, but it's really going to take the organizing muscle of our entire movement. That includes all of you on this to win these policy changes. So if you are ready to fight for healthcare justice, we need you to put ready into the chat. And we look forward to working with you all moving forward. And thank you for joining our conversation today. And two things I want to note before we end. The NIC is not over yet. Starting at 5:30 p.m. Eastern Standard Time, about 10 minutes from now, there is the MIPEX Global Integration Strategy session, which is going to discuss how the US and Canada can foster immigrant integration with policy and how participation in society can be enhanced. So please stick with us on the Socio platform. Do not go anywhere. Stick with us to check that really important piece out. And then tomorrow, there's still more to come after today. Tomorrow, there's a special session open to all NIC attendees. It is Immigrant Worker Empowerment. It is hosted by our wonderful partners at Unite Here. And so I encourage everybody to check that out. And there's two invitation-only convenings: the Asian Pacific Islander American Caucus, hosted by the Asian American Federation and Asian Americans Advancing Justice, and also the Black Virtual NIC hosted by Baji, which is going to happen both Thursday, tomorrow, and Friday. And so for more details, please check out the NIC website. It's critical that everybody check that out. We will have all the details there at nicnewamericandreams.org. That is the website which you can find out all these details. So please stick around for the MIPEX Global Integration Strategy session, and we hope to see you as part of the sessions that are going to happen tomorrow and Friday as well. So thank you, everybody, and thank you to all the amazing panelists, and we look forward to more work with you all in the years to come.
Hello, I'm Mayor Sylvester Turner, the proud mayor of the nation's fourth largest and most diverse city. Welcome to the National Immigrant Integration Conference 2020. I thank all of you for the work that you do on behalf of immigrant and refugee communities across the country. Your leadership inspires me and has been invaluable in helping all of our communities get through this very difficult year, in addition to the many challenges new Americans wrestle with every single day. Your efforts in so many important areas embody what it means to welcome newcomers in our communities. Thank you for promoting English language learning programs, access to citizenship classes, community health services, workforce and business development opportunities, access to immigration attorneys, and so much more. In Houston, we are working on innovative ways to provide immigrants with COVID-19 information that goes beyond traditional alert systems, such as television, radio, or print media. We partnered with local community organizations to have immigrants record videos in their native languages to help us spread COVID-19 prevention and testing information. The videos are shared on platforms used by the immigrant community, such as WhatsApp. We also reach out to the immigrant community through virtual town halls hosted by ethnic media and other trusted voices. Through these trying years, one thing has remained the same. Our work and solidarity are essential to our collective progress and prosperity. But this is no time to let up. We are a proud member of Cities for Citizenship, a growing network of nearly 100 cities and counties. Together, we promote the expansion of naturalization and financial empowerment programs nationwide. We must continue to support the endeavors that welcome and empower immigrants, encouraging more to join us. I, along with hundreds of municipal leaders throughout the nation, am deeply committed to your work. We will continue to champion causes that bring our nation together and uplift us all. Thank you and enjoy the conference.
This is a song about a farmer and his life on the Blue Nile River. The food that he grows, that he brings to his kitchen table and many kitchen tables. It's a praise song for farmers. It's a folk song. And sometimes when I'm singing it, I think of like the millions of people who've sung it in the past, you know? I mean, people say that folk songs have no author, but really, 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 they have many authors. And so it's like a prism, like a piece of each of those voices is in it. And part of its power comes from that, you know, those millions of voices inside a single song. Abai mado fila sari allo bere anana kabere. Abai mado fila sari allo bere anana kabere. Hobarani yale berbuch buharurer. Waganund magabi bamere tausere tankro bimisraat lager bishagna gaberen yemi belt ketomen alina are yod mamun are yod mamun are yod mamun are yod mamun maratona bibo limlim momina يا جبردكم يسرع وتتنو يا جبردكم يسرع وتتنو أباي ما دوفي لو سريع لو بري أنا كبري أباي ما دوفي لو سريع لو بري أنا كبري Meratun abibo limlimo minayo ya gavaradikam yasra watetnu atkel firafre abkai firafre ya get alinta aras you gavere are yo de mamun are yo de mamun are yo de mamun are yo de mamun Yasaga yakabe Yamani watetu Akabiu gabare Honun bayanetu Akabiu gabare Honun bayanetu Abay madofila Sari allo bere anana gabare Abay madofila Sari allo bere anana gabare Yasaga yakbe Yamaria watetu Akrabiu gabere Hulun beyanetu Kaptun sasimara Denistum malada Mistum de etalet Uhalet akida Arikyo de mamun Ariyo de mamun Arikyo de mamun Ariyo de mamun Jochim yilalu Alinish mama Bafina chohedu Injatu lekema Bafina chohedu Injatu lekema Abay mado fila Sari allo bere anana kabere Abay mado fila Sari allo bere na 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 Abay mado filauser yalo bere nana gavere Abay mado filauser yalo bere nana gavere